Cardiac tamponade. Cardiac tamponade is a condition where there is a accumulation of the fluid within the pericardium. Causes: it can be certain penetrating causes, traumatic, infections, neoplasms that can lead to accumulation of the fluid within the pericardium. So the pathophysiology here is, if the fluid gets accumulated, the heart function gets compromised, it gets compressed, and because of that there will be decrease in systolic blood pressure leading to hypotension. Also there will be elevated jugular venous pressure. So on an examination, when we auscultate the patient will have muffled heart sound. So I already mentioned the three features, and that forms the Beck's triad, that is hypotension, elevated JVP, and muffled heart sound. And here the patient might present with breathlessness and chest pain, and it is purely based on clinical diagnosis. Investigation is not actually much required, and even if it is done, it's basically act as an adjunct and will not affect the clinical diagnosis. The normal examination and the features explains it all, that it's a cardiac tamponade. Coming to if we are going for investigation, echo can be done or fast scan to detect the presence of fluid in the pericardium. Coming to the management, so definitely we need to stabilize the patient, and IV cannula has to be inserted, pulse oximetry, the vital parameters has to be checked for, and the emergency management is needle pericardiocentesis. And here it is the needle has to be inserted from the subxiphoid sternum towards the needle should direct towards the left shoulder, and it should be directed in 45-degree angle and inserted. And once we feel that the resistance has gone, that time we might have reached the pericardial space. Pericardium, in the cardiac tamponade, around 60 to 65 cc accumulation of the fluid results in these kind of features. But the good part is that as soon as we remove 10 cc of the fluid, there is a relief of the symptoms like the hypotension and the muffled heart sound. They significantly reduce. But the definitive therapy is thoracotomy that is being done. And in case if we have to start with the IV antibiotics, IV analgesics, it's important IV antibiotics to counter the secondary bacterial infection, and IV analgesics for the pain, and oxygen therapy can be given.